Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. This podcast episode, it's about lasers for vaginal health. And I think this is a very important topic because the most recent technology that was launched in the last decade in the United States, specifically in the early 2010s, like 2014, for vaginal health improvement was laser technology. We really haven't come up with anything new. The newest thing for vaginal wellness is laser technology. So as I mentioned in the podcast episode where I discussed painful sex, laser technology for vaginal health has been around and has been used for many years before 2014, when it was first introduced in the United States by a company called DECA Lasers. Actually, the laser platform for vaginal wellness was acquired by Cynosure, which is a laser giant who developed many platform technologies with various clinical applications, not just for vaginal wellness, but for beauty. Now, the use of lasers in the United States is not new. We have used lasers in medicine and gynecology for surgery and ablation of lesions for many years prior. However, in the last decades, there has been focused scientific research on applications for the maintenance of vaginal health, for healing issues rather than destroying the disease, which is what lasers have been used for gynecology before, and also with a focus on improving sexual wellness for women. There is a huge demand for safe treatments with minimum downtime and minimal to no risks or side effects that can actually resolve and help heal serious medical conditions that cause painful issues for women and that could actually improve the sexual well-being for women, especially those who suffer from painful sex. Now, outside of lubricants, vaginal dilators, hormone therapy, a couple of home-use devices, pelvic floor therapy, and PRP injections, we have come short of addressing women's sexual well-being needs. Now, here's the thing. Let me talk about some basic stuff. The act of intimacy requires repetitive friction between the vaginal skin and that of the male organ, the penis. The vaginal tissues right at the entrance and inside the vaginal canal need to have certain qualities in order to sustain the repetitive physical forces of friction that occur between the penis and the vagina during the act of intercourse. If the vaginal tissues are dry, then the friction becomes impossible. It is simply not tolerable. It is downright painful to the point where a woman will have to say, no, this is not going to happen. The vaginal walls and the tissues at the entrance need to have a certain amount of thickness. Otherwise, once they become too thin, they lose a lot of the qualities that are necessary to sustain this friction, including the moisture and the elasticity. And again, last but not least, I mentioned elasticity, the vaginal tissues at the entrance of the vagina and the vaginal canal itself need to have this elasticity. There's a certain give and take, push and pull that happens during the act of intimacy that requires the vaginal tissues to display at least a minimum for the act to be tolerable, if not a significant amount of elasticity for the act of intimacy to actually be pleasant. Once the elasticity is impaired or gone, the friction during the act of intimacy with the man becomes downright intolerable. So the woman will have to say, no, I cannot do it. It is too painful. I've already went down this path, addressing the quality of the tissues after menopause. Nothing does it like estrogen. However, there are circumstances when the estrogen dosing has to be kept very low due to various reasons like fibroids, adenomyosis, pelvic congestion syndrome, or possibly due to fibrocystic breasts after menopause. There are also cases when a woman suffers from an estrogen-sensitive cancer, either presently or has suffered in the past, and there is the belief that the risk of using estrogen outweighed the benefits, a belief that's being challenged more and more. Now, in such cases, laser therapy is the next best thing to estrogen that we presently have that can improve the quality of the vaginal tissues. So let me take a few minutes and talk about how does the laser actually work. Well, it depends on the type of laser because each type of energy delivered to the tissues of the vaginal opening and the vagina itself will do slightly different things. However, ultimately, the goal of any laser treatment is to improve moisture, thickness, and improve elasticity of the vaginal tissues, as well as lift and tighten loose skin and loose tissue, either for better function or for better appearance. In this episode, I'm focusing on the various applications to improve function, not appearance. But stay tuned for that. I might come back to that. I want to stay on topic, which is vaginal wellness and lasers, and we can talk about pretty vaginas at a later time. I'm going to say a few words about the various laser platforms available in the United States in a few moments. But before I do that, let me discuss a little laser information and facts that you might have heard and probably know already. Treating the skin of our face and various parts of our bodies, cellulite, crepiness, etc., and using laser technology for that is not at all new. The cosmetic or aesthetic industry has been using laser technology to improve the appearance of fine lines and wrinkles, to melt fat, to do all kinds of things for a very long time. Some very modern laser platforms deliver gentle energy with minimal to no downtime without any evidence that the person had a laser treatment that day. Other platforms are able to deliver very powerful, strong energy, which leaves the skin red, swollen, inflamed, ultimately peeling off the dead layers over the next 1 to 2 weeks, revealing the glowing, soft, smooth skin underneath. However, that means significant discomfort and downtime anywhere from 3 to 21 days, depending on how intense the energy delivered is. The more significant the immediate visible result that you want, like I want my face to look different in a month, the more energy we need to deliver. Now, this has been rather the norm and a standard in the aesthetic industry. Minimal treatment, less results, but significant results over time with various repetitive sessions. Significant big gun treatment, you get immediate results, but one single treatment, okay? This type of treatment, the big gun approach, does not apply to the vaginal tissues. You do not rejuvenate the vagina by burning it off. And I'll mention a little bit about the term rejuvenation in a few minutes. We do not want to erase wrinkles in the vagina. Instead, we need our vaginal wrinkles back. I mean, inside the vaginal canal, we need our vaginal folds. Those are called rugae. That means turning a thinned out, dry, and inelastic vaginal skin into an elastic, moist, thick skin with the young folds. Now that, my friend and listener, is the true rejuvenation. However, in spite of this being an actual true rejuvenation, and this is exactly what it is, we take a dry, thinned out, inelastic part of our body and transform it into thicker, moister, more elastic part of our body. That, my friend and listener, it's again a true rejuvenation. There has been an active campaign against the use of such term as vaginal rejuvenation. In 2018, I believe, if my memory serves me right, all laser platforms for women's health received very threatening letters from the FDA against the use of this term. But the truth remains, because if the laser can actually do what is promised and give a woman back her moisture and elasticity and take the pain away and improve the wellness in that part of her body, then that is a vaginal rejuvenation. However, there are laser applications that can also improve the appearance of the skin at the entrance, make the feminine folds thicker, give the skin a desired lifting effect. Now, that, my friend and listener, is not the podcast subject today, but apparently that was the target of the FDA, taking issue with the use of the platforms. So now let me ask you something. Why is it okay to rejuvenate the face, but it's not okay to rejuvenate the vagina? Why is it okay that a woman wants to look pretty when she looks in the mirror, but it's wrong that she wants to look pretty down there too? Well, I would say it's nobody's business. The woman can do as she pleases. But in this episode, I want to focus on actual medical applications to use the lasers for. So I'm going to come back to delivering energy and how to do it to improve function. for vaginal wellness specifically. Now, most, if not all, laser platforms that have been developed specifically for vaginal wellness deliver gentle energy that requires a series of treatments, allowing a gradual improvement in these three desirable qualities we're looking for, which are moisture, thickness, and elasticity. Now, what about pain or downtime when we use lasers for vaginal wellness or to improve sexual well-being? Well, literally nobody would come back if it was extremely painful. That would scare them off, number one. And number two, delivering too much energy all at once can possibly increase the risk of scarring, which is the last thing that we want. I can comfortably say that pretty much all the laser platforms that are used for vaginal wellness do not hurt at all. For some of them, we don't even need numbing. For some laser platforms, they create a micro injury. We might need a few days of downtime, usually not more than 3 to 5 days. And by downtime, I mean avoiding any vaginal intercourse or the use of tampons for a few days. After the vaginal walls have been treated with different sorts of energy, we don't necessarily want to risk side effects or complications by exposing the vaginal tissues to unnecessary friction, to soaps, to deodorants, to various chemical lubricants, to the jacuzzi water with bromide and other things, or the pool. We want to stay out of the pool. Now, do these laser platforms work to deliver what they promise? Well, of course they do. Not only would the first laser platform no longer be in business 10 years after being introduced into the United States in 2014, but now we have a plethora of energy platforms that are specifically designed to treat vaginal tissues. This is booming business for the laser company. The only downside is access. You need OBGYNs and you need OBGYNs in private practice that are willing to invest in these platforms. As I mentioned in my previous sexual wellness mini-series episodes when I introduced the idea of laser for vaginal wellness or vaginal health, you will not find a laser platform at the community health clinic or at the big group clinic like UCLA or Cedars-Sinai. That is unless the private equity owning the clinic or the private investor that owns the medical practice is willing to take a huge risk by buying a very expensive equipment and then relying on the doctor to market, to sell the treatment to the patient. And this process involves many things, including the doctor buy-in. That means the doctor has to have complete faith and trust in technology, have to have experience or have seen the technology, be completely willing to dedicate extra time for the learning, for the training, for the marketing, for the performing of the procedure with the support of the staff who all have to do the same thing. They have to understand it, talk about it, answer questions about it, and provide pre- and post-care answers to all of the questions. Now, all of this requires faith and willingness to take a risk, and many private investors or owners of a clinic system or the board of directors that approve such an expensive purchase would not do so without some certainty that their clients are going to benefit from it, number one, but ultimately, whether or not this technology is going to pay off and bring a profit to the clinic, because this is just common business sense. So buying and offering a laser technology for vaginal wellness is a difficult undertaking. It is fraught with danger and financial risks, so they're not available everywhere. These laser platforms are very expensive. The cheapest platform would be around $100,000, but they can go as high as $250,000. That is a small mortgage. The practice has to list the equipment and finance it usually with a 5-year lease. That means the practice has to rely on having at least 3 to 5 patients monthly that want to use the laser. Therefore, the practice can pay off the monthly payments, maybe make a profit. Now again, marketing and talking about the laser costs money too. I'm not even discussing that. That could be more expensive than the monthly laser payment nowadays. So the price for the vaginal laser treatments are going to be high. And that is why, my friend and faithful listener, you need to know this. Yes, this technology is expensive. And yes, it is cash pay only. There is no insurance that is going to cover any laser treatment for vaginal wellness. We're not there yet. Okay? So though the end goal seems something that many women should want and strive for, trying to convince a patient to laser their vagina against a hefty sum of money will not be easy. Now, why is that? Well, many women who suffer from painful intercourse after the age of 50, let's take that group of women, for example, they find themselves in a situation where they're either single, not quite sure if they're ready to mingle after a bad divorce or some other issues, or they might be in a relationship where the husband has a health issue, or either both of them or the husband, their partner, has lost interest in being intimate, and either the partner or the woman or both are no longer seeking or desiring intimacy. Therefore, these women simply give up. Now, it is really difficult to convince a woman who finds herself in this circumstance that restoring vaginal wellness and vaginal health to her vaginal environment by using a laser therapy that costs money and is not covered by insurance is beneficial. And on top of all that, if the woman is single, without the motivation and the justification of investing in this treatment as a price that is to be able to continue intimacy with her partner, she likely will not be willing to spend the money that is needed to cover the laser cost. Now, here's the point I want to make with this specific discussion, is that above all else, we women should not ignore vaginal wellness just because we no longer desire to be sexually intimate with a partner. Maybe 10 or 20 years down the road, when you're 70 and still able, limber, and healthy, you fall in love again and you get married. I've had quite a few patients in their 70s, newly married, who had come to me before the new marriage, were diagnosed with a vaginal skin condition that required hormones, laser, possibly both, possible PRP injections, dilators, possible steroids, etc. But they chose to do nothing and walk away. They were like, I'm not having sex. What's the point? Well, guess what? They found the point quickly when they fell in love, they got married, and they came back a few years later wanting to resume being intimate because the obstacle that they ignored was now really bothering them, and now they really wanted to do something about it. They were ready to throw money at it. So I had to be frank and explain, hey, it's not just money. It's commitment. It takes possible side effects of the hormones, multiple sessions of the laser treatment. And not one, but quite a few women decided after counseling and explaining the pros and cons and giving them the alternative of being intimate without vaginal intercourse, they decided to not go through with the treatment and just give up. So, this is one of my favorite sayings, 1 ounce of prevention is worth a pound of cure. Another big point I'd like to make with this episode is that we do not need laser treatments to the vaginal opening of the skin at the entrance or the vaginal canal simply for sexual pleasure or simply to continue to allow intimacy with a male partner, but also because the vaginal wellness and our microbe of the vaginal environment is critically and ultimately connected with the health of our urinary system. There is now a term that encompasses vaginal and urinary issues caused by menopause. And that umbrella of changes due to the estrogen deficiency after menopause is called the genital urinary syndrome of menopause, short GSM. As women, we cannot ignore our urinary health. So taking a little parenthesis here. I'm not talking about incontinence. I'll get to that in a couple of moments or maybe next episode. I'm talking about urinary tract infections, also known as UTIs. I personally have been blessed to only have had one UTI in my life, that it was my mid-40s, perimenopause. I know why it happened. I was overworked, sleep deprived, and dehydrated, so no wonder it happened. But I remember feeling like something was badly off. Suddenly going to the bathroom, peeing blood, and the discomfort and the chills and the body aches. Again, it was my one and only UTI, but I felt sick to the bone. Of course, I immediately knew what it was, prescribed myself an antibiotic, called in sick, left early, went home, rested, hydrated. I was good by the next day. I was back to normal. But many women, actually an astounding number of women, are suffering from recurring UTIs. They keep getting UTIs, sometimes once a month, sometimes 2 a month, sometimes once a quarter. If you have been prone as a young woman to get UTIs, you are more likely to get them after menopause, especially if you keep having sex. The loss of estrogen, which is the water, the irrigation system for our inner intimacy garden, the thing that it makes it bloom, that it makes it stay elastic and moist, that's the same to our lining of the urethra and the bladder. After menopause, many women suffer of frequency and urgency and start getting up in the middle of the night to pee numerous times, which of course disrupts their sleep. Now, poor sleep leads to fatigue and a decline in your mental clarity the next day. That means loss of stamina and endurance and difficult recovery from whatever exercise you subject your body to the next day after a fitful, restless sleep, where you wake up 3 times or more to use the bathroom. The lack of sleep and the subsequent fatigue will make you short-tempered and irritable, Because in all honesty, when you feel exhausted and are dragging through the day, barely getting by, trying to survive, how can you cope with someone or anyone asking you to do something that makes you feel you have to go above and beyond? When you barely get by and have no energy for anything extra. The sweetest, nicest person in the world can become short-tempered if chronically sleep-deprived and exhausted all the time. So please don't think, well, we just need to pee more often. What's the big deal? It is a very big deal. If you cannot go on a long drive without needing to stop a few times to use the bathroom. I've had women who told me they couldn't drive to Los Angeles to do their commute or drink coffee in the morning before they started their commute because they needed to stop at least once to use the bathroom. And that would be a 1-hour drive only, okay? Imagine you take a 1-hour drive and you have to worry about stopping once or twice. Imagine how bad things are when you need to know where the bathrooms are before you embark on your trip. That is not okay. Our urinary health is extremely important, and failing to realize how vital that is for our wellness, especially optimal vaginal wellness, is a mistake. It is well known that after 65, getting a UTI can unfortunately lead to sepsis. Some of these UTIs make no noise, and they go on and on until you get a kidney infection, and that turns into sepsis. So women can die from a simple UTI. Yes, an older woman can die from a simple UTI. I'm going to repeat that again. So the best cure for recurrent UTIs after menopause is estrogen. But in the absence of estrogen, laser technology is the next best thing. Yes, there are medications to calm down your bladder, but you condemn yourself to taking medications for the rest of your life. These medications do nothing to address the cause. It's simply a Band-Aid. You stop taking it, whatever that medication is, an antispasmodic, an antibiotic, your symptoms come right back. So many women try to drink less water, so they don't need to go to the bathroom so often. That makes them dehydrated and triggers other very important changes, including a more concentrated urine, which unfortunately can be more irritating to the bladder. So that which you try to avoid is now unfortunately worsening the situation. Also, we need to change the mentality and belief that our vaginal environment and our vaginal wellness is purely related to sex, because it's so much more than that, especially as we get older. I want to drive my point home, and then I promise I'm going to get back to the lasers. But let me use an analogy. Our mouth is essential for eating, so we want to check our teeth on a regular basis. We want to go to the dentist. We want to clean and floss and take care of our mouth, because if we ignore our ability to feed ourselves and nourish ourselves, and we don't take care of that, ultimately, the way we live will be significantly impaired to the point of death. Our mouth is essential for our survival, so we take care of it. Now, our ears are also significantly vital for our survival, because if we become deaf overnight, we can still live, but it will be a very different life. However, many people ignore checking their hearing until they actually have a serious problem. What's more important than the point I'm trying to make is that many people do not go to the ear, nose, and throat doctor to check and inspect their ear canals, right? You can't look inside your ear just like you cannot look inside your vagina. You need a doctor or a qualified healthcare professional to do it for you. However, I don't know about you, but I really have only gone to the ENT doctor when I had a very serious need for it, which was 1 year into the pandemic in the summer of 2021 when I developed an abscess on my left tonsil, most likely due to the fibers from the prolonged masking I had to endure as a requirement of working in the hospital environment. So no one goes to the ear, nose, and throat doctor, the ENT doctor, to check their ear canals. We rely on our primary care doctor to do it for us. Now, this is where the analogy ends. Let me come back to vagina. Like, lady, what are you trying to say? What's your point? Well, if the primary care doctors would be properly trained in vaginal wellness, they could very easily do the same service as they do for the ear canals. However, most primary care doctors are far from being trained in any way, shape, or form to assess or optimize vaginal or urinary wellness for women. So your best bet would be to stick with an OBGYN for your annual checkup. Yes, it is easy to have your annual PAP and a vaginal wellness check with your primary care doctor. You might as well do it. We all want to save time, right? It's easy. But I urge you to give vaginal wellness and vaginal health the attention it needs and the care it needs. Check in with your friendly OBGYN doctor once or twice a year, and it's not a bad idea to do that as we age. Worsening vaginal laxity, atrophy, changes of the vaginal skin at the entrance to the vagina, the weakening of the pelvic floor muscles. They're all important to be detected early and addressed early, so permanent disability can be prevented. Now, this was quite a big parenthesis about why vaginal wellness is important, and it's not necessarily a plea to consider a laser therapy, but more to bring it to the awareness of you, my listener, the true fact that many women ignore vaginal wellness until they have a serious problem. Now, going back to laser therapy, let me discuss what I promised, and I will continue in this next episode that is released next week, and I will give you information about all the various lasers that exist on the current market. I'm going to talk about what they do. I'm going to weigh pros and cons. I'm going to give you some information about possible benefits that they could offer. We're going to talk about what some lasers are used for, what are they best known for, and which one should you choose depending on your problem. So come back next week to find out the nitty-gritty about all the laser platforms available on the US market today. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.